All right, a very good afternoon to you, Ikena, and a good morning to those who are waking up at this time. Good evening to others who are already going to bed. Once more, it's Samantha Biake from Better Mind Foundation, your everyday host, and my co-host today. She's wishing to be in the dark. I don't know why, but I have a great thing for you today. So today we have Ikena from IKON Foundation, and he has something great for us. I don't want to say a lot before him introducing himself, but just know that today's session is one of the rare sessions that we've ever received from Better Mind. Well known that since June, we started a program called Untold Stories of Refugee, but today we brought you something more important. We're talking about health. So when you saw Ikena Foundation, people are like, what are you going to talk about? You were all surprised, but today we're talking about health. So let me not take much of the time. So let me let Ikena introduce himself. Ikena, you're most welcome.
Thank you so much, Samantha. Thanks for having me. And good morning to people on the other parts of the world, and good afternoon to everyone on our time zone, and good evening to wherever you are if it's evening. But my name is Iken, Sam had said, and I'm a fourth-year pharmacy student. So next year I'll be a pharmacist, and I'm originally from Nigeria. And I met Sam. How we got to know was doing one of our outreach programs, doing my one of the programs I had for like a health community. That's how we got to know each other. And essentially today I'm going to be talking to you guys about IKON Health Foundation. And before I get started, I want to just ask you guys a question. So when you think about healthcare, what comes to your mind? I'm going to pick on someone if no one says anything.
I think I'll go ahead and pick. Before they open their microphone.
Tell me, Judith, when you think about healthcare, what comes to your mind? I think they're shy. It's okay.
Hello.
Yes.
When I hear about healthcare, healthcare is things we do maybe to keep our life in good. To keep our life good, maybe away from sickness, maybe keeping good hygiene and sanitation, things that can make us stay stronger and happy without pains or sickness or anything.
Those are great points. Things to keep us live longer, to keep ourselves together without pains. Those are really great points. You touched on big key points. But there's one thing, anyone else has anything to say? If not, I'll move on. I was gonna say, there's one thing you're missing, Judith. So especially when we look at the parts of the world we come from Africa, when we talk about healthcare, we always associate a cost to healthcare. We think about, not everybody's able to afford healthcare. I'll use, as a case study, we'll use Nigeria as an example, and even Ghana. When you compared our African countries to what we have in the United States, here, most healthcare, it's expensive, but at least we have some sorts of like insurance or places that you can come in and get taken care of. But in where we are from, we operate on most places will operate on a fee for service. That means if you don't have the money, you're not going to be able to get that healthcare. The amount of money that you have is going to translate to the type of and level of care that you receive. So the reason why the whole IKON Health Foundation came about was because ever since prior to me studying pharmacy, I've had a background in international relations. I've always wanted to work to improve the quality of life for ourselves, for my family, for my friends, and just for the whole African continent in general. That has always been my mission. That's always been my goal. That's always been my passion. And when I ran into Sam at this event we were having, it was at a place called the Exchange House, which is a facility that most of the refugees in the northeast of Ohio and Akron, where they live, some of them stay. They come there to take their care. They feed there. They have most of their events there. And I was really, really very, very touched at that event when I met Sam, because I was very, 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 like, it brought me to tears to see a lot of our people, my people, were not able to, when we were going through their health screens. A lot of them do not really understand or know exactly how things should be done from a health perspective, you know? So me as an individual, I'm telling myself, what is the purpose of being educated if my community and my people are not going to benefit from it? And it was after that meeting that I was able to meet, I had a conversation with Sam, and I told Samantha, hey, I think we need to come up with a kind of a process where we can deliver and expand and increase healthcare and literacy for our people. And that's how IKON Health came about. This is something we've been talking about since 2020. And, you know, COVID did not let things happen last year. And I'm so happy that despite COVID, despite all our challenges, our busy life and our schedule, we were able to move forward and come up with this IKON Foundation. And I'll tell you a little bit about IKON, what we do. So just in general, it's about IKON. So IKON is basically a nonprofit organization. We're based here in the United States, but our main focus and goal is to provide exceptional care and services to like low income, underserved, and like developing countries worldwide, not just in the United States. So people like me, you, and people like that need the services the most. And through our outreaches, our main vision would be to try to raise awareness, like increase health education, as well as like improve the quality of life overall, like for us and our community. So some of the things that we actually have, some of our mission is, some of the things we have in our mission is to actually work on delivering exceptional health services to our community, to the African countries. And also, most importantly, one of the things we're also working on trying to do is also to improve and target some of the sustainable developmental goals of the United Nations. And some of those goals include, like, you know, getting rid of hunger, water, poverty, access to healthcare. So that's where IKON comes in. And I'm happy to announce that through the support we've received and through our relentless spirit, we were able to get through and fully get registered. And some of the services that we will be offering will be like doing blood pressure screenings, checking your blood sugars to see if you have diabetes. We're also going to be running some panels to see if someone has a high cholesterol. As we all know, cardiovascular diseases are one of the leading cause of deaths worldwide, not just in the United States. I'm going to narrow it down to Africa. I know many times where I have been called, or I have like read in the newspaper, somebody died out of a heart attack, or out of a stroke, or someone was taking a shower and they just fell, you know. And then, you know, we always attribute these things to like voodoo or like native medicine or things along those lines. But one thing we do not know is that a lot of these conditions can be prevented. A lot of these things can be prevented. And one way to prevent them is by having regular access and regular screenings. Hypertension is a big one. Hypertension means high blood pressure. And hypertension is one of the silent killing diseases that we have in the world. A lot of my friends, a lot of my elders I know walk around with blood pressures that are extremely high. And this put them at risk for like stroke and at risk for heart attack and at risk for like all sorts of, you know, problems that can just manifest acutely. So that's why IKON Health Foundation came into play. So what are we going to be doing? What are we going to be doing for you guys? Or what are we going to be doing for our community? What are we going to be doing for ourselves? So some of the initiatives we have going on, I know first things is to try to get out in the community, try to do a lot of screenings. So at these screenings, we're going to try to have blood pressure. We'll have like staff, medic staff checking your blood pressures and checking your blood sugars to make sure that your blood pressures are not so high. And if they're so high, we'll be able to have some educational tools and be able to tell you the next step to go in terms of who to go see and to get referral. The same thing with your sugars, the same thing to monitor for diabetes. A lot of people die, especially in our parts of the world, from like diabetes. And that's very, very sad, especially when I look and see how easy how easy it is to manage diabetes here in the United States. But back home and where we're from, we don't really have as much awareness out there for these things. So that's why people don't really see or understand that they have to manage diabetes by checking their sugars every day, watching what they eat and things like that. So basically through IKON Health Foundation, we're going to try to be the pillars. We're going to try to be in the community. We're going to try to make sure we raise awareness and people are educated and people know about these things. Because we believe that preventive medicine is like you're trying to prevent something from happening. It's the best way to cure a disease. It's better to prevent a disease than to wait till a disease happens and then you cure it. So some of the things we have lined up, I would want to talk about is actually tomorrow in Ghana, we're doing a visit at an orphanage, and it's called Tishe Orphanage. I'm sorry if I didn't say it correctly, but it's a Greater Accra area. And we're going into an orphanage, and we have about we're distributing hand sanitizers. We have about 2 cartons of chicken, and we're cooking for them. We're cooking a lot of food and taking it to them. So not just healthcare. Again, our goal is to like focus on improving quality of life as a whole. So that's one thing we're doing tomorrow in Ghana. And in the United States here, we are working with Bettermind, Samantha's organization. And we're going to be bringing our very first health screening community health fair. And we're doing that in the Akron area in the Akron area of Ohio. And we're targeting our Congolese, our Africans, and most of the refugees, as well as we're going to open it up to the community. But we want to actually show that charity begins at home. You know, if whatever we're doing, if we are not able to deliver that dividends of goodness to our people, then for me personally, I don't feel like I'm a successful man, or I won't be satisfied. So I'm very happy that Samantha was very instrumental, and we're working on getting that done. We're working on getting that health screening done next week, because that would be very vital. Hopefully we'll be able to see how much lives we can connect with and hopefully impact at that visit. And moving forward also, we do also have some things we're working on in Nigeria in the next 2 weeks, where we're going to a school. We have a team of 5 volunteers going to a school, and they're giving them educations about, picking a partner and genotyping. This is one thing that that needs a lot of education. When I mean genotypes, I'm talking about like the various blood group, the blood types, like AA and AS. I don't know if you guys are familiar about that. And AS and AS, we typically tell them not to date or not to get married, just to reduce the chances of getting sickle cell. So, we're going to talk about education on that in about 2 weeks in Nigeria. And at that place, we're also going to be hosting a tournament, a soccer tournament, where we'll be awarding 3 students 1 year tuition each, like 1 year for their school fees each. So, and I'm so excited, I'm so humbled, and I really, really would love to see what we can do, not just here in the United States, not just in Ghana, not just in Nigeria, but also in Congo, in Uganda, everywhere, every parts of Africa. And I believe none of this can be done alone. It can only be done with your help. It can only be done with your support. So I would like us to connect on a more personal level, on a more geographic level. I want to see what we can do together, IKON Health Foundation and Better Minds, how we can join minds together, bring people together, and most importantly, improve the overall quality of life and improve our overall health, our overall wellness, and most importantly, support one another and bring and create a better environment for ourselves, not just for ourselves, but for our children and for our future children. I don't want to talk too much. So at this point, I'm going to keep quiet and I'm going to ask if anyone has questions or if anyone has any comments. I would be happy to address those. And I would say we are on Instagram, our names, and we are also on Facebook. Just look up IKON Health Foundation and you'll be able to find us. But I'm going to keep quiet and I'll let you guys ask me questions. Or I want to hear any questions you have from a health perspective. And if I don't have the answer, I'll be able to get back to you on that right away. So I'll open up the floor to you guys.
Thank you so much, Ikenna. Thank you so much. I think people are seeing my smile. I know some are like, Samantha, that smile is always on, but this is special. Why am I saying it's special? Ikenna is our very first partner in the health facility. So we are having different partners, but Ikenna is our very first partner in the health facility. It's something so overwhelming, and I thank God for that. As Ikenna said, we met at a rare occasion. It was one of the Better Mind series, because Better Mind, for those who know, Better Mind started way back the year before. I mean, it was in 2020. So we started in January, then Corona hit in March. So that's how life has been, but we didn't stop doing what we're supposed to do. Corona didn't stop us because it's here as a way, as a stepping stone, how best we can support our community. My second source of happiness is to see people in the diaspora doing something for their home country. As we kind of said, charity begins at home. It's useless to make yourself better, but your home look dirty. Why should I put a lot of makeup when my room looks so dirty? It doesn't make any sense. So it's the same thing that Ikenna is having, the same thing that Better Mind is having. Like if you check our headquarters of our organization, they're all back home. So here are part of our organization, but the headquarters are back home. It's also beautiful that we are having our very first health walk, or can I say, how do you call it, health tour, outreach, and the very first one starts in Akron, in my city, in the Better Mind premises. It's so great. I feel so happy that the refugee in our community are going to be the first people to get the the food with a lot of all the ingredients. No one has touched it. So people in Akron, just know that this is for you. And we are not only going to be limited to the refugee from Congolese community now. We are going to be serving everyone. So we're not only serving the refugee, as we mentioned, but serving the refugee, the host community, American. This is also for you because you gave us a hand, you gave us a land. So we're also doing this for you. And Ikenna say they're doing it for the better of us, to inform us. Guys, most of the time I usually say, sometimes we go to the hospital thinking that we are seriously sick, but it's just a matter of talking to someone and you'll be healed. That goes with like mental health. Not everyone who's mentally disturbed or mentally sick mean that that person has been bewitched. Sometimes it's just a matter of stress. The person is having a lot of stress. The person has been reading for a long period of time and didn't get time to rest. And then the person end up getting that stress. So I want to open the floor. I don't want to take the floor because for me, I'm receiving everything. Just know like I'm in contact with Ikenna. Yeah, every time. So I want to open the floor for people to ask questions. Those who are having questions, I want you to ask questions. Don't ask questions only limited to America, because Ikenna Foundation is also coming back home in Uganda. It's coming back home in Ghana, in Nigeria, in Congo, Africa. We are coming back. People in the diaspora, we are coming back. So I want you to ask questions and also give us advice on how best we can extend our service to you. The floor is open. You're almost welcome.
Hello, everyone.
Hello.
Hey, Samantha, how are you?
I'm doing fine. Thank you for joining.
Welcome. I've just joined. I've just returned home. Was busy, but as soon as I saw this, I had to join.
Thank you so much.
I found Ikena speaking, and I just picked some of the last statements he was communicating. Yeah, I'm glad that Africans are starting to rise. Africans are starting to know that this is our mantle. Our great grandparents did their part. Now this is our part. We also need to do our part. Samantha is well informed. Hey, did I mention my name?
Now,
Okay, guys, I'm called Jack Musoke. That is my African name. I'm from Uganda. Samantha is my good friend. She's my Ogi. I'm the director of an NGO called Human Uganda. It is a non-profit organization in Uganda with lots of campaigns. Basically, right now carrying out one called Shoe a Child in Uganda. We're basically looking at kids aged between 6 and 15 years that go to school in barefoot. We want to eliminate that, starting with Uganda. Then we shall hopefully expand to other places and launch other programs later on. But back to the issue of what Samantha has just discussed, I would just like to know from Ikena. Is it Ikena?
Yes, Ikena.
Yeah, I just like to know, are you guys basically in health alone, or you're also venturing to other sectors, say civic education, human rights, and all that stuff, or you're basically targeting the health sector?
So
Thank you so much.
it's a great question that you ask. So our main focus, so the reason why it's called Health Foundation is because I'm in the health sector, and you know, you need a lot of credibility for you need it. It gave me the credibility to go ahead and name my organization our organization IKON Health Foundation as opposed to IKON Foundation. But to answer your question, we're just not limited to health. We're limited to other sector. I remember, I don't know if you had joined earlier, I had mentioned that some of our areas of focus would be some of the SDG goals of the sustainable development goals, which some of them include like hunger, poverty, water, and some of those areas. So we're open to anything we can do to improve the quality of life of our people. And I don't know where you joined in, but I had noted that actually tomorrow we're going in Ghana. Our organization will be visiting an orphanage where we're cooking for them some food, and we're giving them hand sanitizer, and we're teaching them how to make certain things like hand sanitizer and and those items. And in Nigeria, like I had mentioned, we're going to a school to teach on relationship and genotyping in relations to like sickle cell. And we're also going to help we're going to host the soccer tournament, which is football tournament, and we're going to award the 3 first, second, and third place winners. We're going to award them a scholarship for their tuition. And also we're also in another school in Nigeria. We're also doing we're going to the school and we're supplying them with all the health things they need. We're giving them toilet roll, soap, hand sanitizer, buckets for like their water, so they can be able to get water and things like that. So to answer your question, we're not just health focused. When we're in Africa, we're looking for anything that we can do to better, any way we can help and assist to better our people and our living condition as a whole. Did I answer your question?
Answer your question?
Yeah, thank you so much. The issue is because I think I joined a bit late, but I've fully understood. Thank you.
No problem. No problem. So I do like your approach of your nonprofit organization. You said Human of Uganda.
Human.
Okay. So I do like that approach. So maybe what we can do is Samantha, maybe we can try to do drive together with IKON Health and Better Minds. We can try to see if we can solicit for like donations for shoes, whatever your organization will need. We can try to see if we can join hands, do like maybe 1 month drive, gather up shoes, book bag, whatever supplies that we need that can assist your organization. Is something I think we definitely something in our scopes and something we would love to do. So if this is something you want to do, just let me know. We can me and Sam and you, we can sit down and chat and see what we can do. Because in America, over here we are, it's easier to raise and solicit for donation of items than it is to ask for money. People will give you items, but it's harder to ask for money. So this type of items, we should be able to raise a good drive. 1 month or 6 weeks would be a good to get things together. So I think we would love to support that actually.
Yeah, I think Judith is having that written down. That's one thing that she'll want to take. Like it's better with Ikena is worth doing things. I'm living with him. I know what Ikena is. So Judith, Ikena is a person who wants, when you say something, we work on it directly. So even you can see with our health program, we plan for it, I think, for a month, right? So we're planning for a month, having everything ready, and next week we are having it. So Judith will be writing down for us, and then we shall touch it starting tomorrow. I mean Monday. So Monday we can see how best we can get in touch with Jack. So that's our next project for November. We shall see how best we can handle that. The floor is still open for those who are still having questions.
I see Judith had a question in the chat. It says, you talked about sickle cells. How can one tell their boyfriend or girlfriend that we should go for sickle cell screening? It's not that easy. So how humbly can you tell your partner to see if we match? And the follow-up question to that is, how long does a person with sickle cell disease live? And second, the last question is there a cure to sickle cell? Okay, so to answer that question, I think I think the best way to ask your partner for screening, it's gonna vary from people to people, or relationship to relationship. You just have to be able to know how to communicate with your partner. But I think one good way to get this message across is, if you can focus your conversation on more about your future children and not necessarily more about, oh, let's get this screening done just to see if we match or not. Just think about, hey, honey, hey, darling, I think, before we have kids, we should definitely go and see our genotypes, because we don't want to bring in kids tomorrow that are going to be, sick every literally sickle cell flare-ups comes up, and it's really, really painful. I've seen some kids in the hospital, the pain is really, really bad. So, if you take that approach, like where you're focusing more on your children and the people you're bringing into the world, I think that's a good approach to take. And it's also important to know your partner. That comes in where you know your partner. However you communicate with your partner, that you feel they'll get the message the most. I feel like it varies from relationship to relationship and person to person. But I think the biggest focus should be on the children you're going to bring into the world, and not necessarily, your pride or his pride or their feelings. That's the most important thing. And how long does the person with a sickle cell live? That varies too. I know it depends on the part of the world you are in. In United States here, and actually, this is a very good question. Good thing that you brought this up. In the United States here, we have lots of medications to help manage with the pain, and people here can live. It just varies on people to people. But people in sickle cell here live longer because there's some medications to help deal with, to help control and manage it. But when the pain comes, normally patients end up in the emergency. They stay in the hospital for some time. But I don't know much about. I know, like, in different parts of the world, my uncle actually died of sickle cell. He was not up to 31 years old, and when I come to the United States and I hear about people living like 40, 50, even 60, it's more about management, education, and advancement. So these are the part of the things we were hoping we can advance Africa into forward. with IKON and with like other like-minded organizations that is focused on like the wellness overall. But I think that to answer the question, it just depends on your partner, and try to focus the conversation on your future children. And in terms of cure, it just depends on the area, the country and place you're in, and the access to the medications. And I don't think there's more of medications to manage the symptoms. So I think once you have a sickle cell, you just have sickle cell. It doesn't just change tomorrow and you don't have it. You're always gonna have like medications to manage it when the flare up comes up. So I think that's about it. But I know if you're interested in learning more about sickle cell or trying to get sickle cell medications, I have a good friend of mine. He's from Ghana. He has a nonprofit organization as well called NOB, No One Behind. And honestly, all he does is focus on sickle cell. They're on Instagram, but I think they're based in Nigeria. They operate mainly in Nigeria. I don't know if they operate in other parts of Africa, but if you go on Instagram, you will see like they do a lot of drives. They do a lot of education on that. So if anyone is interested in that, I can throw their name. I'll just put it in the chat. NOB Foundation. You could just look them up and you'll be able to learn more about those. So does that answer your question, Judith?
Yes, please. Thank you very much.
You're welcome.
We are having Tatiana also hands up.
And to add on a little, Samantha, about that.
Yep.
Thanks to the church, basically in Uganda right now, they've introduced something new. Before marriage, at first it was only the HIV test required. But now most of the churches, most of them are now including the sickle cell test too. If you're going to get married, you have to test for sickle cells and HIV. That is a must for now. Yeah.
Wow, that's something we didn't know about, and we are happy that this session is available so that we can learn. Because like sometimes it can most of the time when we fall in love, you say fall in love, something like that. When you fall in love, it's love. You don't remember about the other side effects once you people are together. Especially, let me say about sickle cell. You just fall in love. You don't test which blood group this person is, but once you give birth, the kid become the consequence, or the kid become the victim of something that you would probably prevent. And I think talking about this, it's also a way of making us, awaken our spirit to have those things considered. Because most of the time, like when it comes to health, especially everyone, I don't think like there's a particular personality or population. Most of the time, people don't think about health, especially in our daily life. Like, let me say, for example, with as you said, blood pressure. Sometimes people like wake up, they've died. Like people be like, oh my God, the person just went to bed and woke up dead. But there are causes behind that we don't usually check. Like it's rare for someone to go to the hospital and do just a physical check without feeling any pain. They usually say, I'll go when I feel headache. But even sometimes when people are having headache, they rarely go to the hospital. Like I'll take water and I'll be fine, So we need to have that into our mind. We need to have that into our blood and have it like a consistent thing. I think with this type of this type of organization, I think we shall also use the opportunity to raise awareness about that. Physical checkup is so important. Let's hear from Tatiana.
Hello, everyone. My name is Tatiana, as Samantha introduced myself. I just have a quick question for you, Ikena. I know that you talked about hypertension, and we all know that is one of the most common chronic health problem across the world right now. I was just gonna ask you, what's the effect of education intervention on lifestyle of the patients that have hypertension?
It's another question from Google.
No.
Are you asking, I want to make sure I understand your question properly. So are you asking what lifestyle changes can they make? Or are you asking what is the education, like what education they need to know about hypertension?
Yes, that's specifically. Because like, for example, I know that the educational program of hypertension includes, for example, the physical activities,
Mm-hmm.
your nutrition, for example, stress management. How do you, what are the effects to these people that have hypertension? How can we prevent this? Because not everyone is able to access the hospital or the medication and something. Is there a way we can prevent this earlier?
I'm going to answer your question in two ways. Yes, you can, and no, you can't. Yes, you can to all you said, and no, you can't because some people, hypertension is just in their genes, like it's genetics, you know. Some people have some people have a genetics of like, you know, diabetes. So that hypertension can be in the genes as well, whereby you see people they live a decent lifestyle, but they just naturally have high blood pressure. So, but these are not all the time. So these are cases where you can't control. But in terms of we call it non-pharmacological intervention. That means non-medication lifestyle changes. You mentioned a lot, and those are very, very helpful that will help you prevent hypertension. One thing you didn't mention is smoking. You know, smoking is one of the big. Hello?
No, I said that's true.
Yeah.
Yeah.
Smoking is one of the big leading causes of hypertension that, you know, a lot of people don't know about. So smoking is one of them. Smoking cessation can help. And a lot of things also people don't know is like obesity, you know, I know like in different parts of the world, like in Nigeria, we used to think being big is a good thing because it's like evidence that you have money or you're living good, you're eating well. So like, you know, these are things we should try to educate our people on. Like obesity is not good. Obesity leads to increased risk of hypertension. It can lead to increased risk of like other diseases like diabetes and high cholesterol. And also, while you're at that, you also throw in exercise, physical activity, which you mentioned. Exercise is big. So we typically recommend 3 to 5 days a week, at least 20, 30 minutes a day, like 30 minutes of cardio, 3 to 5 days a week, or 90 minutes a week or 150 minutes. It just depends on your ability. You know, you cannot tell somebody that is old to someone that is 60 or 70 years old, you have to give me 150 minutes a week, you know? So it depends. So I think exercise is a very big one. Weight loss is a big one. So that's where obesity comes in. And most importantly, your dietary intake, you know? We see all this food on TV, they look good on the commercial, the triple burger, pizza, all of those, they all look good with the cheese. Not saying don't eat them, but eat in moderation, you know, eat them once in a while. Try to focus on our local food that we have back home. Our local food back home is really healthy for the most part. Rice, the plantain, you know, unless you have diabetes, then you just have to watch your carbohydrate intake. But if it's just for hypertension in general, just eating good food, exercising, stopping to smoke if you smoke, reducing your weight, and sometimes life is stressful. You can't deal with that, but try to minimize your stress as well, because stress also drives up stress increases cortisol levels, which will lead to like, you know, hypertension as well as high blood sugars. So these are the things you hit them right on the nail. This can help you prevent hypertension, and if you already have hypertension, this can help you manage it so that way eventually with more and more activities you can eventually get off the medications, you know, eventually, but it might take a while. Your body just has to reset again. But yeah, so those are good questions. I think those are good ways we can encourage our people. And actually, this is something we're going to be doing at the event next week as well. As we're screening people, we're also going to be teaching them about things they can do to prevent hypertension and high blood pressure. So and diabetes and all of that. So yeah, does that answer your question?
All right. Thank you, Ekena. Thank you so much.
You're welcome. Thank you.
Ike, I just want to let you know, as we continue our session, that we are so pleased we are so happy and overwhelmed for your consideration to do this, because it's take a nation to raise a child, you know that. So it take a
Yeah.
village to have a good child. So by you thinking about how best can I help my people, how best can I help the world by educating them, it's really something good. My question to you is, are you planning on having like session, like probably sometime it will be very hard to have like probably in-person sessions. I'll give an example of Better Mind. Like sometime like during the COVID time, like we couldn't be, I mean, in the area, we couldn't do what we want to do. We would have like our meeting, we would have like kind of career guidance, mentorship. We have them online. So my question to you is, are you planning on having like an online teaching about a certain topic? Like let me say for this month you are running a breast cancer awareness. Are you planning on having like topic online conversation where you're inviting people, or what we are teaching us, or a recording YouTube program? Are you planning on that?
Yes, that's actually one of the things we have planned and in our agenda. We're just trying to, there's an organization called One Touch to Success. It's in Nigeria. We're trying to partner with them to see if we can have their nurses and there's a group of nurses. See if we can have their nurses and health professions. If we can work something out where, you know, like once a week or once every 2 weeks, we have a webinar on like, you know, on we can do a WhatsApp, we can do YouTube, we can do Zoom, we can have all those platforms accessible where we do like educations on different topics. So I'm glad you asked that question. We're actually working on that process right now. So good question. And we're hoping that in the next 3 weeks to hopefully three to 6 weeks, we should have published dates and like topics and things. And if there's anything you would from Better Mind will want us to come and talk about, let us know. We will prepare like a presentation. I was gonna say I didn't have a presentation to show you guys. I just wanted this to be a interactive session. I didn't want to be just teaching and talking on the first time I'm meeting you. So maybe in the next sessions I'll come in and be like, okay, let's talk about this after I got to know you all. But yeah, so we do have those coming up. And I like what you said, you know, it takes a village. I have a better one, you know. One of the approaches I have in life is I think it might be a Tanzanian proverb that says, if you want to go fast, go alone. But if you want to go very far, go together.
Oh,
So
that's the new proverb that I'm going to
so together, it takes a village, and together we'll get far and we'll get what all of our missions and things we want to get accomplished. So.
Oh wow, that's so nice. In Kenya, just to for the sake of people knowing you, because I know currently you are based in America, in the Northeast Ohio. So for those who would love probably to get in touch with you, for those who would love like to hear about you, because let me say, for example, people in Rwanda, people in Kenya hear about you, because of course you're in Uganda and in Congo. That's a sure deal because of the partnership. And you're in Kenya, I mean in Nigeria, and you're in Ghana. So how best can people hear from you? How can people reach you? Like, do you have Instagram? Do you have Facebook? Like, what are those handles that people can reach out to you? Do you have a website? So we would love to hear about that.
Yes, I'm actually putting in the chat my Instagram, and I'm gonna post also my my email as well. If anyone would want to reach out to like discuss any initiative, anything, if we feel like any ideas you will want to see done in Uganda, if any visit you want to do, school or health screens, we can see how we can make those possible. So I'm putting all of my information down for you in the chat. My Instagram is my personal Instagram is ikena_jr. IKON Health Foundation is our organization Instagram, and I'm gonna put in our email, ikonhealthfoundation@gmail.com. So if anytime you want to reach to me, I'm an open book. Just please go ahead and send a message, and I will make an effort to address and get back to you, and we can work on any ideas or projects that that anyone has, as long as it's feasible. So, and if I can do it, I'll be able to connect with somebody. We connect you with someone or an organization that will be able to get that achieved if it's something you're passionate about. And I'm also on Facebook. My Facebook, I'm gonna put that here. And IKON Health Foundation, we're on Facebook if you search that as well. I would love to keep in touch. I would love to see everyone again, and I would love to hopefully meet you guys and work with you guys, and together we can do greater things in the future. So.
I think we do have another question from Tatiana.
Oh, Tatiana, you have go ahead.
Yeah, I think it's
I'm sorry, Kenna. I'm so curious right now, but since you just put your contact information in the chat, like for more questions and stuff, I was just gonna ask you, like, do you know if hypertension and blood pressure can have an effect on women's, for example, those who are pregnant? Is there like a side effect of it?
Yes, so it's a very good question. So pregnancy comes with a lot of conditions that a normal person might not have. I'll give you an example. In medicine, there's something we call gestational hypertension and gestational diabetes. So those are gestational means like, you know, like women transitioning from giving birth during that time. So pregnant women, sorry. So some ladies, when they are normal, when they're not pregnant, they're fine. But once they get pregnant, because of, you know, pregnancy has a lot of stress on our bodies, especially as women. It does a lot of, it's not easy carrying a whole human being for nine months. It's a lot of stress and a lot of things. But yeah, like some women are at risk for developing hypertension while pregnant, you know? And literally after pregnancy, within 3 to 4 months after pregnancy, they go back to normal, not having hypertension. So yes, that's why it's recommended for pregnant women to go to the prenatal and I think it's the prenatal the prenatal session, and the 1 to 3 months is the antenatal, all of them. So make sure it's very important for them to women to keep these visits and regularly go visit the doctor, because these are the way you'll be able to see and you'll be able to find out if you are at risk or if it's hypertension from pregnancy or diabetes. And, you know, and especially hypertension is very bad with women because it can lead to increased risk for, you know, seizures and even strokes. So like, especially in pregnant women. So it's very, very, very important that you.
So that means it can affect. It means it can affect even the chances of getting pregnant or the reproductive chances, like to both of them, like male and female. If there is
in what sense?
Blood pressure, like let's say for example it's a couple, and one of them has like blood pressure or hypertension. Is there like a chance to not getting pregnant to the women, to the woman?
No, that is absolutely no reason for you not to conceive, because you're worried about not getting hypertension. If that's the case, none of us would be born. Because if my mom is saying I'm not gonna get pregnant, I'm not gonna give birth to Ikenna because I don't want to have hypertension, then Ikenna won't be here, or you, Tatiana. But to answer,
it doesn't have any effect on.
Sorry.
I'm not sure if I understand well, but if you say it doesn't have any effect on people, like in a relationship. So what
it doesn't have so hypertension should not be a reason why you should not date somebody, if that makes sense. It's not one of those. I mean, I haven't studied it to be that. If it is, I'm not aware, but it's not one of the things we put out there, because why? Hypertension can easily be managed. Even women, when they're pregnant, we have medications for women for hypertension, specifically for pregnant women when they're on hypertension. So as long as you take your medications and you follow like healthy lifestyle and make those changes, you will be controlled. Like you wouldn't have to worry about, oh, my blood pressure is going too high, I might have a stroke or anything like that. So hypertension should not be one of the scary things, because it's easy to manage. You know what I'm saying?
Okay. But there is just one thing that I know is like hypertension can cause dysfunctional in the system of a person. And that's my worry. I'm worried about like a couple.
Okay,
What if
so
that happened in between those two people?
okay, so it depends on on the level of hypertension. If
Level.
it's,
Okay.
you know,
Okay.
so there are different levels of blood pressure. There's stage 1, there's stage 2, there's hypertensive emergency, there's hypertensive urgency. I don't want to start getting into the nitty gritty, but essentially, if your blood pressure is between 129, if the systolic, you know, there are two numbers, one is higher, one is lower. If it's between 120 and 130, you're called stage 1 hypertension. If it's between 130 and 140, it's called stage 2. So where we start getting worried is when your blood pressure, when the high one starts going to 180s. So that's where you worry a lot. But if it's typically when it's 130, 140, as long as you're on medication, those medications should help make you controlled, if that makes any sense. That's why you have the medications. Does that make sense?
Yeah, it makes sense. I'm just gonna let Silas ask the question too.
Oh, yeah, like I don't want you to get scared about hypertension, because there are a lot of things to be worried about that is more than hypertension.
And it might take a whole session of education also.
Yeah, hypertension is important in the sense that if we don't control it, when I mean control, I mean by taking medication or by stop smoking and eating good, exercising. If we can control it, you can have bad outcomes, which can lead to, you know, a heart attack, high risk of heart failure, like stroke, all those type of things. You know what I'm saying?
Yeah, and I think that's what the rural population back home, like in Nigeria, Congo, Uganda, these people, they need it.
Exactly. Because by the time they find out they have hypertension, it's probably too high, if that makes any sense.
Yeah.
As opposed to here, if we come to, like, you know, our event next week, you come to an event, we check your blood pressure, we tell you, oh, it's 136 over like maybe 80. Then at least you know that you go see the doctor and you can get started on medication, and then you can start making those changes. In where we're from, if no one has money to go to the hospital, they're probably not going to be able to know their blood pressure until they get really sick. And when they go to the hospital, they check it, they're like, oh, your blood pressure is 170, and then it's really high. And that's where these kind of things happens, if that makes any sense.
Totally sense. Thank you.
Yeah. So don't be scared. We can have a whole lecture on hypertension.
I'm not scared. I'm just asking questions for those who don't know it, including myself though.
Go ahead. I love the questions, but I just don't want you to be afraid of like not dating or relationships because of hypertension. No, education is powerful, knowledge is powerful, and that's why we're here today. So we can have this knowledge to begin with. Thank you.
So I think we can hear from Silas. I'm seeing his hand up. So Silas, the floor is yours.
Yeah, hello to everyone. How are you, Kenna? I am in Uganda. I'm in Uganda, but I'm Congolese by nationality. So my question is mostly concerning about hypertension. As you touched one point, which was which was very, very true. Like in Africa, they see someone who is fat, they try to consider it like someone who is healthy, who is someone doing well in life and stuff. So my question was regardless, like on 2 points. For example, it was the first one. It was about to ask you if you have like in your program like concrete how would I say it, like practical program here in Africa, where, for example, you can be leading people about to that program on how healthy to eat, or it's just about only giving lessons like on YouTube on internet platform. So my question was like, for example, when you touch the point where, for example, one of the solutions to also be treating that, it's also by doing exercise and stuff. So my question was, if you're having like practical sessions here on ground, like for example in Africa, practical examples of how you be leading people going through that problem. I don't know if my question is also making sense though.
It's making sense. Very good question. You know, this is a very good question. So at the moment, we don't have any any set in stone like active physical active program right now, but it's something we're actually planning to work on in the future, like in the next 3 months. Because like I said, we're just like trying to get things evened out and get things like organized in Africa. In the United States, it's hard when you are not there on ground. You have to do a lot of outreach, and that's why I'm happy I have you guys here today. I'm hoping we can connect more. So whatever you're passionate about, you can be like, okay, Silas, you can be like, I'm interested in having like a yoga center or a gym like center where we have every Sunday morning we do Saturday road walk, because on Saturday we can start that program. Call it IKON Health and whatever organization you want to name it. We can do it road walk where every Saturday morning the whole community will meet and walk 10 minutes. We educate them while we're doing this. We can start off as 1 day a week, So those are the things that we actually have in plan. I had mentioned earlier, we actually, for our event in Nigeria, one of the things we have is a tournament. It's a soccer tournament. As part of, health. We're going to do a health talk and we're going to have a football tournament to give education on physical activities, especially at a young age, so that they can go home and hopefully talk to their parents and educate them on those kind of things. So I like that approach, and I'm definitely would be interested in if you have a plan on working on. You say you're from Uganda, but you're in Congo, wherever you're based. If it's something you want to work on, we have a lot of heads in this room. We have Beta Mind, we have Icon, we have Judith, we have Tati. We can all, if it's something anyone is passionate about, it can be a project we can all plan and one time work together, come up with a name for it. If it be like healthy walk for Africa, whatever we want to term it, and we can go ahead and start working those up. All it takes is one person. Before you know it, every Saturday you see the whole village working 30 minutes with you every morning. If you educate them like, hey, and then they'll see the correlation with their health, they're losing weight, then you now go into diets. You start with one thing, exercise. Then you now go into diet. Hey, no more fried, no more, minimize the oil. Tell them, you can start saying as you're walking, you can start talking about let's eat fried food 2 or 3 times a week. You start gradually, and before you know it, you make these changes. So I like that, and I will be happy to sit down and talk more about that. But it's something we had actually had planned in the next, because like I said, I am here, and I don't have a lot of people on ground. People that I'm working with have different focuses. So if there's a focus you have, and I know Sam is nodding her head, I know she's on board. Anything that includes,
I want to tell them something. People, I know Ikena is like going around the bush, like is doing like this. Ikena, just eat the thing. So, Silas, to answer your question, Ikena is available in Uganda. So, Ikena is partnering with Better Mind, and our doors will be open in November. For those questions. So, Better Mind is can I say Better Mind is privileged to have the very first oily food. So Better Mind will have Ikena this coming Saturday. We shall have the underground, practical as you called it. So not online, but Ikena will come to us to Better Mind office in Akron, and we shall have that run. So we shall have the blood pressure, blood sugar. And in Uganda, we are opening our door in November, and Ikena will be there for you. So get in touch, and that's the something that Ikena just going around. I'm like, just eat the bulb, tell them. So we'll be very happy to have you part. As I usually say, Better Mind is not for Samantha, it's for the whole world. Any help that you can give is most welcome. We are doing it for the good of the world. I usually say, what legacy are you leaving behind if God is to take you tomorrow? What have you left behind? What have you done for the world? So in the same way, we are also going to Nigeria. We are going to Ghana. We are going to Uganda. To Congo. We are going to Rwanda. We are going to, South Africa. We have to do this, and this a call to everyone to join. That's why I asked him to put the social media platform there so that people can easily reach out and do something. I don't know if your question has been answered, Silas.
Yes, that's been answered. Thank you very much.
Well, you just answered all the questions. So that means everything we talked about today, Better Mind and Icon and all of you guys, it's going to be our project in Uganda and everywhere moving forward. So we'll make sure we follow up on all of this. You just answered all the questions.
All right, it's been, I don't know if anyone has another question. Just give a minute if you have another question, because we see like we've hit the hour that we were planning to have this. I don't know if anyone has a question. If not, then we shall hear from Ikenna. What advice, what is that conclusion that you want us to stay yearning for Ikenna back on the platform?
My advice to you guys is honestly, keep being the best and keep seeking out more and knowledge. The way you were able to come to this session today to learn more is keep doing that. Keep always trying to find out ways to make things around you better. That's the only way I've been able to get how far I have been in my life today. So like I said, I had started off as my background was in international relations, and I'm switching it. I'm in healthcare now. And everything in each phase of my life, I've always focused on trying to give back to Africa. Even in international relations, while I was in international relations, I used to work with the refugee community here in Cleveland, and I used to volunteer at that time. One of my cousins worked at the United Nations, and I used to do some volunteering with them back home. So like so my advice to you guys is, no matter how little that you have, no matter how bad it might seem, do not ever stop, and do not stop learning, do not stop giving, do not stop trying to improve things around you. The way you're gonna make things better is by the way you receive is by giving. The way you elevate in life is by serving. So I encourage you guys to, everything we talked about today, take it to heart, because these are things we're gonna implement. We would love the way me and Sam, what started off as one visit, and now it ended up as two different organizations working to improve quality of life and our experiences of our people. I want that to carry on. So this is like you see it as, oh, I'm just here for 1 hour session. No, I don't see it as that. I want it to be a genesis of, okay, let's start thinking about how we're gonna implement everything we talked about. Doesn't have to be from one perspective. Any avenue you come from. Look at Better Minds. Look at IKON Health. Look at other. We have different focuses, but at the end of the day, we come together. We come together, and the goal is to make things better for our people. So that's the advice I give to you guys. Don't just leave here and just wait forward to hear from another talk about hypertension or health or anything. No, I want us to leave here. I want us to start thinking about how we can implement these things that we talked about. Okay? I really, that's one of the things I would love to hear, because we can't come again at the next meeting and we meet and we ask questions and we talk again about it and nothing happens. So I think that's one thing is, I know we all have our busy lives, we all have individual lives, and we have things going on, but that's one advice I would want to give. Let this be a starting point to where we can look back on today's date, which is of October 21st. Like, remember how this all started? It started at that Zoom meeting on the 23rd. So that's one thing I would love to see. That's the advice I have for you guys, okay? And if you guys have any last words for me, just feel free to let me know. I've enjoyed you guys. Thank you so much for your time, for giving me the audience. It is my utmost pleasure. I am sincerely grateful and I'm humbled for this opportunity. And thank you for hosting me.
Thank you so much, Ikenna. Thank you so much for accepting our invitation. Thank you so much for being here today and educating us. There are a lot of things that we didn't know about, but you've opened our eyes, you've opened our ears, you've opened our hearts to ask more questions. I know some of us have been having those burning questions. Now we've got a platform to always ask those questions. Let me say, the sake of high blood pressure, diabetes, cancer, other questions regarding health. Some of us have those questions and we always ask ourselves, how are we going to know more about it? As Tatiana asked about high blood pressure, even cancer is genetic, but people don't know that cancer is genetic. They usually say, oh, the person died with cancer, but they don't know that the whole clan, the whole family has that gene that will probably cause cancer tomorrow. So it's really an eye-opening topic for us, and also giving us the urge to ask more questions. We want to say thank you thank you so much for accepting our invitation and being here today. And as a culture that Better Mind has, we always have a token of appreciation to our guests. It's one of like, it's a culture for the time being. I remember there's a day I went to New York for a wedding thing, and then the people that we went with told the side of the girl like, I know you've been talking for a lot. I want to give you water to cool you down. So a token of appreciation for you not being in Africa. We usually work with Teresa breweries, so they usually have yogurt, wine, and juice, but you're not in Africa. There's no West Teresa that will give you. But we have No High Pop-Up. It's a restaurant that we usually also work together with. So you can have any choice of food. So every week they have new food. So you can have any kind of food that you want there, and Better Mind will cover it for you. Or else, if you don't want to eat, you can also go ahead and choose any immigrant. So Better Mind is all about supporting immigrants. I'm sorry to say that for other people, but that's the truth. You can also choose any immigrant organization or any immigrant restaurant or probably boutique or something, and just let us know what you choose. Send us the receipt. We want to cover that for you. So that's a token of appreciation that it's a culture that Better Mind has every day.
I love this culture. It's a great culture, and thank you. I am honestly humbled by it. Thank you.
Nini.
Again. Thank you so much, Ikena, for being here.
Thank you, Judith.
I also want to say thank you so much for everyone who participated today. And those who are going to watch Better Mind series, I say thank you so much for keeping it a culture to hear or learn more from Better Mind YouTube. For those who would like to know more about Ikena on Instagram, she is Ikena Junior
_Junior. Ikena
Junior. And the organization is IKON Foundation.
IKON Health Foundation.
IKON Health Foundation. Go ahead, follow, like, and reach out to them. On Facebook, they're also there. Do you have a website?
We're working on the website. We'll have it live in January.
Okay, it's also be there. So in case that's also there, just go ahead, reach out to them. Ikena is there, it's open, it's going to answer all questions. And also, if you want us to have Ikena back on the platform, don't hesitate to reach out to Judith and Better Mind, or else me, myself personally, or Tatiana, because she's the co-host of the all the event. Reach out to them and we shall have Ikena back on the platform. Go tell your village mate. Go tell all the people around. Tell them we have this burning question, we have this burning topic. Ask questions and we shall be able to answer you. Thank you so much for being here. I remain your host, Samantha Biake, and today's guest was Ikena Junior, and the other name. Oh my God, I wish I go back to Nigeria and learn the language, but
Igbo.
Igbo?
Igbo.
Mm-hmm. How do you pronounce your name?
Ogwebu. Ikena Ogwebu.
Okay, I like that.
By the way, do you know I can't
even try?
What'd you say?
You know I can't Oppo?
I can't Oppo.
I can't Oppo. Baby,
I don't know.
No, just stop it.
I know. So that was it. By the way, thank you so much. Until next time, bye-bye.
Have a good day, everyone. Good night. And